Well, good morning. It's Dr. Bill Williams on the Influencers Podcast today from Atlanta, Georgia. Live, we're talking with a good friend today. It's not often that I get to talk with somebody on my podcast that I've known for many years and that I've interacted with. But today is a very special day. We're going to bring in the Executive Director of the Good Samaritan Health Centers of Gwinnett, which is right here locally where I live in Atlanta, Georgia. So welcome, Greg Lang, to our show. Hi, Greg.
Good morning, sir. Thank you for having me. How are you?
Always nice to get back with friends, and I'm doing well. I've already been out for my 3-mile walk today with my friend Sadiq. We've gotten home. We've put things together here, and I'm sitting in my office doing something that I love to do is bring people in who are very influential in the community to tell the world about, what they're doing and how it works. So I want to give you a chance to kind of explain how we got together, how it started out, what happened, where you were when you got started in the actual Good Samaritan Health Center. So it's all yours. I'm going to let you have the floor.
Okay, thank you. And congratulations on the walk. As humid it is recently, I'm walking at 4 o'clock in the morning to try to avoid the heat. And that's not always fun to get up that early. So my story is that I've been in healthcare in one capacity or another since 1982. So a little better than 40 years in the healthcare industry. Most of it, 30 plus years, spent in the for-profit sector, working in managed care, psychiatric hospitals, software, venture capital funded activities. And I actually just got tired of the constant strain and stress of trying to generate a profit while delivering services to people. So I left the healthcare industry briefly, and for a period of time was volunteering through my church with a variety of ministries that our church supported. And one of those ministries was this organization. There it is, the Good Samaritan Health Center of Gwinnett, which was 5 years old at that time. And I began to volunteer, attempting to help the organization do what it was doing, and that was to serve poor and uninsured people on a low-cost basis for citizens of Gwinnett County. And unfortunately, there was not a good business plan. There was not good strategic management of the nonprofit. And I could see that as someone having come out of the for-profit background. And indeed, eventually, the organization ran into financial challenges where it had to cease to operate. And it did close in the summer of 2010. Was out of business for about 4 months, and then was relaunched by a group of businessmen who also affiliated with my church, who knew how important it was that we have a safety net clinic in Gwinnett County. And they came together, pulled their resources, and said, we're going to restart this thing, but now we're going to run it like a business. And I had contacts within that group of people, and they asked me if I would be willing to join the organization and bring business acumen to the nonprofit and help it to not only restart, but become sustainable. At that time, it was 80% dependent on donations in order to meet its financial obligations, including a payroll. And the consumers of the services, the patients, under that business model back then, were only bringing about 20% of the operating needs to the checkbook. So you can see where donors might have become fatigued about being asked to help bail out the organization on a month-to-month or quarterly to quarterly basis. So I think there was wisdom in those men who restarted it to challenge me to create a business out of the nonprofit and not just simply a charity. When I came on board, we were open only 2 days a week, and we had 4 part-time employees plus myself. And I just started to tinker with it. Did a few things about its fee structure, made some changes in its hour of operations, actually adding hours so that our customers would have greater opportunities to access us, develop partnerships with universities to send faculty in as volunteers, worked with students who needed clinical hours in order to get into graduate school, and really reached out to churches to convince them that as a Christian ministry that was delivering low-cost health care in the name of Christ, we needed churches to be present in our pool of donors. And they stepped up to help us do that. So it's now 12 years later, and we are open 6 days a week. We have 2 locations. We have 58 employees, and we see north of 30,000 people a year, which is a significant jump from where we were years ago. I know I've used the term business a few times. We are still a charity. We sell our services for a price that is less than it cost, but we've figured out how to create enough volume that combined patient revenue now is covering about 75% of our operating costs. So we have almost cut our need for donors by 2/3. We're asking donors to contribute about 25% of our operating needs today. And I think that's the beauty of our organization. It's very sustainable, and it has enabled us to grow. And we're happy to do what we're doing.
Greg, that's a good overview. Gives clarity to the reason for our podcast topic today. You know, the Good Samaritan Health Center was an infant when I first heard about it. I came in and got involved pretty much a couple of years after you did, and you talked about the expansion. You've done so much as the executive director, and you know one thing I can recognize is you pulled in good people to be on the board. You pulled in good people to be on the team, and you supported those people totally, so that the people working at the Good Sam were always applauded and celebrated as good contributors to the community. So you know that always comes back on the leadership. But let's talk about the time where I got involved, because I want to put this in perspective for people around the world. There was a dental expansion needed and planned, and that's where you called me to be on the board, and we charted a course to start adding services. And when we started adding dental services, that really changed the face of what Good Sam could do because of certain things. So let's talk about the partnerships that you already started talking about.
Sure. So as you point out, you were one of the founding dentists of our dental service. You and one other gentleman in the community helped us to add the dental profession to our services. We had been medical only when I first joined the organization, but I was invited to attend an event that is hosted by the Georgia Dental Association, I think every 2 years, where for a weekend they run a free dental clinic for poor and uninsured people. And I went to that at a convention center on a Saturday and was overwhelmed to see more than 2,000 people in line waiting for the doors to open so that they could see a dentist. And that just impressed upon me how great the need was in our community. So we embarked on getting into the dental business. Um, um, you and a few other gentlemen helped me to understand the dental business, helped me to identify vendors, to see what our needs were, to help us understand, the range of services or the scope that we could offer in our practice. Um, and you had volunteered for us, been in the clinic to help see patients or even receive them in your office. So we opened that dental clinic in August of 2016. And I just ran these numbers the other day. In our first month, we saw 43 patients. 90 days later, we were at 130 patients a month, which we were thrilled about. It made us believe that, we had probably struck a real need in the community and that we were going to be well utilized. Today, we have doubled our capacity. We started at 6 chairs. Now we have 12. We started with one dentist, and now we employ 3 full-time dentists. And in a busy month, we'll serve 700 people. And since the first patient that sat in a chair, and again, thanks to you for helping us to get prepared for that moment, we have now served more than 39,000 appointments to people that are poor and uninsured and unable to pay the traditional competitive retail prices for the services that they require. So, God has helped us show up big in our community in that way. And, even during the pandemic, we slowed down a little, but people still get toothaches. People still need fillings. We worked throughout the pandemic and continue to see patients today. Unfortunately, there's been a few sister dental charity clinics that the pandemic or the current economic strain. So we get more phone calls than we can handle, but we stand up to the pressure and serve as many people as we can.
Well, thanks for all the work you do to support the expansion of dental services among the community. It's one thing to have free dental clinics, but it's another thing to have sustainable dental clinics. And that's one of the big things that Good Samaritan has done better by many people's recognition than other places, is that they have sustainability with their clinic. And a lot of clinics come and go because they don't set up a business model that actually works. And so your partnership concept of working with the schools, with the universities, with the charities, with the businesses, getting grants from different organizations. And this is what survives, is the people that have a deep understanding of how to fund a project, but also how to run it well. And so that's really speaks highly. I want to ask you a question about those that failed. You didn't fail. You've succeeded totally in this endeavor, but why did those others fail? What's the one thing they did that you know? What did you learn from them so that you could avoid it?
I don't want to be too hard in answering this question, but I think that there are many charitable inclined people, many ministry driven people who fail to appreciate that a nonprofit is still a business and it must function like any business. And that is that at the very least, you must break even. And if you're unable to do that, you are in a failing enterprise. And there are many clinics in Georgia, in the Southeast, across the country, that have a sense of, I'll just say pride in offering free services or services that cost as little as $20. Um, and then they're overwhelmed with their overhead. So they start doing things like minimizing the number of hours that they operate, or requiring that the individual live at a certain poverty level, or that they live in a certain geographic zone, or that they have a state issue ID. All of these filters that begin to be imposed on the front door are designed to keep people out in order to keep the overhead low. And my spin on that is, if you really want to serve your community, if you want to love your neighbor and take care of your brother, you want as many people who need to get in the door to be able to walk through the door. So we eliminated all of those barriers, and that enabled us to serve a tremendous amount of people. But of course, that skyrocketed our expenses. So as I said a moment ago, at the very least, we had to break even. So we began to experiment with charging people fees and how much we thought that our customer could tolerate. And we pressed them to tolerate the highest amount of money that they could afford to spend, which may not sound very charitable, except that when you look at our price sheet, what I would ask one of our patients to pay today is usually 25 to 30% of what my dentist would ask me to pay if I had an appointment this afternoon. So they're still very, very low. But again, they're significant enough that it reduces our dependency on donors. So I think the failure of any community charity is not recognizing that the bank doesn't care that you're a charity. There better be money in your account when the payroll comes through, that the mortgage lender or the lease landlord doesn't care that you're a nonprofit. The check better not bounce, or you're out of business. And if you lose sight of having to manage that bottom line, again, you're in a failing enterprise.
Greg, this is exactly why Good Samaritan is so successful, and the fact that you have come from a profit background to run a nonprofit. You understand that, and you promote, financial sanity. One of the ways I saw that you succeeded was that you recognized pretty early that there were not enough dentists willing to volunteer their services to run a clinic full time. You couldn't bring people out of the woodwork to man the need. So you actually hired full-time dentists to work in the clinic. And that was something that you had already hired some full-time or maybe more part-time physicians, and you had full-time nurses and nurse practitioners maybe in the clinic. But you recognize that for a nonprofit, you're not going to be successful only on volunteers. So that was a major understanding that survivability means you've got to have professionals on board who are paid at least close to the going rate.
That's correct. And that was made abundantly evident during COVID. A number of the clinics in our state that provide free services are staffed almost entirely on the backs of volunteers, who more often than not are in their senior years and have retired or approaching retirement. Well, who was the vulnerable age group during COVID? That very population. So the volunteer pools dried up, and here are clinics that are receiving requests for services that in the past they were able to deliver, but today they cannot because the volunteers were unwilling to come in, especially in 20 and 21. But again, with our paid staff who needed their income, who we pay competitively, by the way, we were able to stay open throughout the pandemic, and we served every medical patient that showed up at the door, and we did every dental service that we could do after the ADA restrictions were lifted on the limitations of services in the very early days of COVID. So yeah, volunteers are wonderful. We still accept volunteers. We love them, but It's hard to make a volunteer feel obligated to you,
Exactly.
but we can do that for an employee.
Now, I want to kind of shift a little bit to a future webinar that I'm going to be involved in at 4 o'clock today with some medical personnel and others. And we're talking about bringing access to Africa, medical access, increasing the ability. And so your experience really does speak well to that topic. So I just want to get your take on it. How do you bring access to good medical care, such as a Good Samaritan, to an area that's underserved? What is the first or second thing you would look at doing to actually start up a clinic like yours in an area that really has inferior infrastructure, has inferior access right now?
Pardon me, I'm so sorry. I think the first thing that I would do if I were being dropped into a region like you described is identify the leadership in a village or a community and work with them to create appropriate expectations. There is a lot of mission work occurring in Africa. And so often people swoop in and provide a lot of services at no charge and with little expectation that the community is going to participate either financially or with labor. And I really think that even in a less developed country, there's opportunities for a community to take ownership in a ministry and feel an obligation to help pay for it or to provide labor to support it. And the reason I believe that is that I'll just tell you a real quick story, and it's in reference to wells. Clean water is a major issue in Africa, and the distance that people have to carry water is a concern, and that labor usually falls on the women. So drilling wells is a popular activity. If you just walk in and say, "Hey, I'm going to put a well in, and we're going to, erect it, and we're going to turn it on, and then we're going to leave," what happens when the well breaks? Well, the village waits for the next mission crew to come in to rebuild, repair the well, rather than doing it themselves, because the ministry team did not teach them how to manage the well, how to maintain the well, how to repair the well, or have an expectation that they would work the well. But if that expectation had been established early on, then in the absence of the missionaries, the village is empowered to make sure that their well operates appropriately so that they continue to have clean and running water. So you just, as an analogy, apply that to almost any mission work. If you want to just parachute in and do good work, but then leave, you've done a big favor for people for a short period of time. But if you train them and enable them to help themselves in your absence, then the period of time, the duration of that benefit is much greater and potentially indefinite.
I can see the analogy, teach a man to fish rather than give him a fish. I can see the analogy of working with sustainable partners, not just fly in and parachute in, as you say, but find people on the ground who are going to support, train. So I agree with you totally. It's pretty close to the picture of what we did in Kenya over a 10-year period. We kept coming back to the same place. And ironically enough, we flew a team of builders into Kenya and partnered with the local folks to build a hospital. That was our first mission project, was to build the hospital. And then the second round was to bring in physicians and dentists and hire local people to run it in our absence. And every year we'd show up and see the progress. And after about 10 years, we turned it over to the local government and they staffed it completely. So it was like baby steps, one step at a time, grow it. And finally, they have similar thing as the Good Samaritan Dental Clinic in that remote village.
That's great.
I think your model works well, and I just want to promote. We got a worldwide audience listening. Many of them are in Africa, in the Middle East, the Far East, and they're listening to this, and they all want access to medical care better in their homes, their communities, and so I think the value of you being here, Greg, is your experience telling people that they must partner, they must find resources within their country. They're not going to want to expect it to be given to them, dropped in by parachute every, few years, another drop. Now it's got to be consistent from within. So great instruction. Let's talk about what motivates you internally to push on and keep going. You've had a successful career. You've been I heard somebody told me you were a pretty successful author. And you don't have to work, but you work because you love to work. Why is that? And what do you feel is pushing you forward?
Well, we are a Christian organization, and I mentioned early in the interview that I came to Good Samaritan through my church, specifically the community outreach department that procured volunteer opportunities for the membership, and I had a desire to serve at that time. And that's what really opened the door for me to be a Good Samaritan. But I started to realize the rewards of the changes that I was making. So it made me really think about all of my experience. And I finally came to the conclusion that it wasn't just my hard-earned experience, it was lessons that God was teaching me for a reason. And that reason and perhaps my purpose became revealed to me was that I had to invest the knowledge, the skills, the gifts that I have in bringing healthcare to our community. Again, we were only open 2 days a week and had 4 part-time employees, and we've exploded in contrast to that. And I have to say that it, glory to God, the credit to God, because he prepared me with the knowledge and the ability to make that happen. And again, I had help. You were a help. Others on our board were a help. Got great employees. But I was the trigger, and I really consider what I do today to be an act of worship. I'm sacrificially giving myself to the organization. We lead devotion every day. We pray for our patients and pray for our volunteers. We give God credit in our publications and our marketing for our successes. So what's driving me internally is my gratitude for my salvation and my desire to please the Lord by loving on my neighbor in ways that He has gifted me to love on them. Healing miracles were the most often mentioned gift of Jesus Christ on earth. And, so to be in a healthcare setting and to do what we do just makes me feel like I'm walking with the Lord.
Excellent. Thank you for sharing that. And I remember you told us that you started at the Good Samaritan helping people park cars. Because the parking lot was so limited, you had to kind of guide them in and out. And you were not the executive director on day one.
No. And that's exactly right. So my clinical training is as a counselor, and I thought that I was going to come in and help bring psychology counseling to the patient base. Failing to recognize or remember that I didn't speak Spanish. So the majority of our patients that needed counseling were only Spanish speakers, and I was just of no help to the organization at all in the original capacity that I offered. So I said, well, I hate to not be here. What can I do? And on that, and actually, thank you. This is a good segue to some of the changes we made. At the time that I was volunteering, the clinic would accept new patients on open enrollment day, 1 day a month. And we accepted 50 people. And if you did not get accepted on the first Monday of the month, you had to wait until the next month. Well, you're right. It was a 4,000 square foot building. It had 27 parking spaces, but it was going to accept 50 people. So after the staff parked and then the patients started showing up, we had an overwhelmed parking lot. They were parking on the grass, parking on the sidewalk. So I got assigned to be the parking lot attendant, and I was out there doing my best to try to keep people from running over each other, while in some cases up to 200 people stood in line with their qualification paperwork in hand. No matter the temperature or the rain, they were waiting for their opportunity to go through the front door. And even though they knew only 50 people would be accepted, they didn't mind being number 200, 225, because everybody was hopeful that everyone ahead of them would be denied, and that they would get in that door. So I realized, two things on that day. And the first day that I did that, and one is the parking lot was too small. If we were really going to grow the ministry and serve our community, and for those of you that don't know, Gwinnett County has now exceeded 1 million residents. So we're a big place. 27 parking lots were not going to take care of the number of uninsured people that were in that county at that time or today. So I realized immediately that we needed more capacity. But also, going back to the concept of opening the doors wide, if we want to serve the community in the name of the Lord, I don't want to be standing there saying, you, not you, not you, but you and not you. I want to serve everybody. So we eliminated that open enrollment day and agreed to accept new patients every day of the week. And we continue to do that. And instead of 50, we receive 275 to 300 new patients a month now. And that's helped us to grow. And it's kept people out of the emergency room. It's kept them from accruing unmanageable medical debt. And who knows, potentially it's kept people alive because they could get access to care in a more convenient way.
Excellent vision to see the need for growth and to respond. The Hard Rock Cafe has a motto when you walk in: love all, serve all. And that's pretty much what I would say you have outlined and identified for the Good Samaritan Clinic. But does the Good Samaritan have an actual motto for the clinic?
We do, and we've had two in my history. Our first one was based on the Good Samaritan parable, which of course is our namesake, and our tagline was "Doing likewise," because that's what Christ said to the Pharisee when he identified who was most merciful. He said, "Go and do likewise." So we intended to be a merciful organization, and we were using that as our tagline for quite a long time. As we developed our dental program, and then we opened a pharmacy, and now we're doing case management and counseling, referral coordination, as well as workforce development. We're taking interns and training them to be medical assistants, dental assistants, PAs, NPs, and we've even had dentists and medical students do internships with us and help them acquire the experience necessary to be competitive applicants into the graduate school. We just do so much more than simply deliver primary health care, that we changed our motto to transforming people in communities. It's not just about managing your hypertension anymore. It's about recognizing that if you are well, you can go to work, you can pay your rent, you can provide stable housing for your children, who then can stay in place in a school system and be well cared for by teachers that know them and are motivated to change their circumstances. But if someone's in a health crisis, they're also in an employment crisis, which results in a housing crisis, which results in children changing school systems in and out as parents chase the next lowest rent opportunity that they can find. So, the real work of serving God is not just, again, to manage hypertension or even diabetes, but it's to help people to establish a stable household that is going to produce thriving children. And that's why we switched to not just transforming individuals, but also our community. We want to keep people out of medical debt. We want to help people to stay employed. We want to help them to have the resources necessary for housing that will keep children in place.
I think people might want to rewind the tape right here and listen to that little speech again. That was a very unique proposition that healthcare is not about hypertension. It's not about fixing a cavity in a tooth. Healthcare is about giving people the opportunity to live life unimpeded and
Absolutely.
to be productive. And I think that's sometimes what we lose sight of in healthcare is that we're procedure oriented or we're disease oriented. We're not life oriented. So kudos for you to bring that out. And I encourage people. I know when we were working on different clients, one of the priorities that we would raise at the clinic when I was working as the dentist in the clinic was cosmetics. Of course, we always want to relieve pain first, but secondary, we want to give people a presentable outlook so that their employment aspects go up, so they can get a job, so that they can get a family orientation. Somebody with teeth does a lot better in the world than somebody without a smile.
Absolutely.
And I think that's kind of the focus we have to have in a charity clinic. You got to look at what is going to serve the entire community, the entire family, not just what the patient wants.
Absolutely. So we have many stories about restoring smiles that help people to improve their speech, their ability to nourish themselves, and then their self-confidence going into a job interview. I very distinctly even remember a 17-year-old boy that had broken his tooth in a sporting event, and he came into the office like this, and he just never moved his hand and talked to us just like this the whole time. I mean, just the amount of shame that he must have felt, as a teenager in high school. Among peers are brutal. But we were able to restore that for him, and he could move his hand away from his face, and he was happy to do so. And that was a transformational for him, life changing for him. Gave him greater self confidence. So this might be an answer to the earlier question about what contributes to failure. And you did this very well for us, and thank you for it. Helped us to define what is the scope of our practice. You're right. We want to restore smiles, but we weren't going to do whitening. We weren't going to do veneers. We weren't going to do implants. That is incredibly expensive. It requires a long-term commitment on the behalf of the patient. We know that our population is transient. And we finally just had to confess that we can't be everything for everybody. We're going to have to figure out what we can do well, what we can repeat over and over again, and become more and more efficient at that so that we can keep our prices as low as possible in order to serve as many people as we can. And so, again, and giving advice to anybody that wanted to be into the nonprofit business, you're going to have to accept the fact that you'll need to say no. You cannot say yes all the time. If you say yes all the time, it's like constantly adding onto your house and you're never finished. And then, one day you spend all your money. You have to be able to say, this is our scope. We're going to stay within that scope. There's some people that are going to be unhappy that we're going to say no, but turning one patient away might empower me to serve three more that are requesting services that are within our scope. And that could be disappointing to one individual, but it's great news for three more. Um, so we do cleanings, extractions, fillings, root canals, crowns, partials, and dentures, but that's not an exhaustive list of the dental services that your profession can offer. And we've just realized that the rest we cannot handle. We may help you find it elsewhere, but we're not going to do it ourselves.
Well, I think the population that you serve is certainly benefited from everything that is done at the Good Samaritan Clinic. I know. I interface with a counselor who's worked at the clinic for many years, goes to my church, and so I know you give mental health counseling, medical services, dental services. Anything else been added since I've been there?
We did have the pharmacy, the medication dispensary while you were here, and we've added case management or care coordination. Patient navigator is a new term that's used often in the healthcare industry, and there's actually a degree program available for that. And that really recognizes that our country today is shifting rapidly and closer to being a minority majority population. We have many, many immigrants nationwide, and especially in this community. Many people who come from undeveloped countries that don't understand the U.S. healthcare system. So even if they could afford to pay for something or had financial assistance that made a service available, they don't understand what happens. They don't understand how to access this, what follow-up care means. And a patient navigator sits side by side with them, almost like a mentor or a tutor, to teach them how to use the U.S. healthcare system. And we've added that to our mix of services so that when we have to send somebody to the hospital for any reason, that we hope they go in with their eyes wide open, fully prepared for everything that might happen, and also having done all of the prep work that they were supposed to do before they get dropped off at the front door.
Well, what you're saying is it's like you're providing a translator because you're translating the medical. I'm thinking it's like a maze. You got to translate how to go through the maze to the person
Exactly.
who's going to enter that system because they'll be lost and overwhelmed.
Exactly.
That's pretty much a piece of advice. You need to have a medical translator by your side, particularly if you're not from here. I mean, my wife serves as a medical translator to everybody in her family. I mean, she grew up with me in the dental practice, was my dental assistant, and she's become the chief medical officer of our family because all her nephews and aunts and uncles and all go through their medical crisis. She's the one who sits beside them, during their crisis. So she knows more about medicine than I do at this point.
I have the same role in my family.
With understanding why. Hey, this is important to ask this question. What advice would you give to your 20-year-old self, knowing your career path, knowing what you've done in life? How would you advise your young self to go forward?
I would say be more intentional in my course selection, in the employment opportunities that I pursued, because I think we've accomplished a lot, and I praise the Lord for using me in this way. But I didn't know that I was going to be here. If I did know at age 20 that I was going to be here, I might have prepared myself in such a way that we could have been 3 times the size that we are today. And I mean, to be able to serve 100,000 people a year would just give me great joy.
Yeah, you've been threatening to retire for as long as I've known you because you said, I think I've done my job, but I turn around and you double the size of the clinic since I was there for 8 or 10 years.
Yeah, we went from 4,000 square feet to 25,000 square feet, and we're actually looking at a third facility. We are waiting for an answer to a funding request that if we receive that, we'll be able to build our third location. And we have a new plan, so this is part of the transformation that I mentioned earlier. We realize that we're innovative and we do things differently over time. Our next clinic is going to be more of a training site than it is a production site. There are many people who are not bound for college who want to be in the healthcare or the dental field. So they want to work as a medical assistant or a dental assistant. And if they're unable to get on-the-job training, they have to go through an education program. Those private programs cost $10, $12, $15,000 for someone to complete. And it does improve their income some, but not enough to have that much student debt. So it's our goal to, again, using volunteers and a sound business model to create a school that will train upcoming medical and dental assistants over a 5-month period and allow them to exit without any student debt, so that whatever difference they make in their earning potential immediately goes into disposable household incomes. They can use that to change their lifestyle rather than use most or all of their higher earning capacity to fund a student loan.
Greg, that sounds exactly like something that could be exported to other developing countries, to take populations that really can't afford extra money for school, but to put it to use. So excellent idea. And I think you got something. I asked you a couple of years ago to write me a little treatise on your business model, you remember, and I'm still waiting on it. I want you to share your knowledge on paper. This model you have is unique. I don't think I've heard about it anywhere, and I think the world's going to take advantage of your experimentation and development of the Good Samaritan Health Clinic in Gwinnett many years after you're said and done.
Well, thank you. I'd like to believe that I've been a disciple and I've raised up a few people to continue on when I actually do retire. And we believe in sharing everything that we have because it belongs to God. So I'm happy to send written material or copies of forms to anybody that might want one. We encourage people to come to our clinic to tour and to visit and to receive mentorship. Over the years, we've probably helped a dozen clinics get off the ground by sharing with them what we've developed and our expertise and how we operate. And to me, that's good. That's kingdom impact. And I'm grateful for, having the opportunity to be a part of helping the wider community.
Yeah. Speaking of mentors, do you currently have a living mentor and somebody who's still impacting you?
That someone that's still impacting me. Well, you might remember our board chair, Sam Kaywood, who has no healthcare experience. He's a lawyer, but he's funny and brilliant. So I love to get his take on really any matter that's happening on the landscape at the moment. He's a great believer, and will pull scripture out of the air that I can't even remember having read in the past. So a good gentleman to be with.
I agree with that. Sam was a wonderful leader for the entire board and was steadfast. He always put forth great effort. Why is being impactful important to you?
I have been blessed in my family, with my health, with my career pursuits. And I recognize that they're blessings. They're not things that I earned. God has even blessed me beyond that and has promised me, eternal life and abundance in heaven and the pleasure of his company. I'm grateful for that. And I think the best expression of gratitude I can give the Heavenly Father is to accomplish something in his name. not just to sit back and relax and wait for the day, that I get my reward. I should be constantly feeding into the kingdom as an expression of, or pouring into the kingdom as an expression of my gratitude for what I have received and what is to come.
Wonderful statement. Hey, how can we support you and the Good Samaritan Health Centers of Gwinnett? How do people contact you, donate, do whatever they'd like to do to support you?
We have a robust web page, Good Sam Gwinnett, GWINNETT.org. And you can find information about how we operate, our policies, our statement of faith, how to volunteer, or how to make a donation on our website. And as a nonprofit, donations are important. So that's always my first request, is consider offering us a gift. But we are a Christian ministry as well. We think of ourselves as a church, and we live in a time where many of the things that we believe are challenged or even frowned upon. So the second thing I ask for is prayer. If anybody wants to remember us in prayer, and just pray that we would continue to have favor and could function well without the enemy getting a foothold, we would appreciate that too.
Thank you, Greg. Very good. We do want to support you. And I ask you, was your experience on the show today at least as good as a board meeting?
I enjoyed it very much. You got to ask me some questions I didn't expect. I had a chance to think quickly about, and even boast a little bit. I don't mean to boast, except I'm just so proud of what we do. So I had a great experience.
Well, I enjoyed interviewing you and being part of Good Samaritan. I knew the story before I started, so it was like slam dunk. I could do this, and you came through in shining colors. Always good to hear the words of an experienced leader like yourself. So I want to give you the final word before we close out, and then I'll come back after you give the final.
Well, I have made no secret of my Christian faith as we've had this conversation. So to all of you, I'll just say that you were loved by the Lord. He cares for you. He has even my 4-year-old granddaughter says this: God has a plan for you. So be confident in that and commit your labor to Him, and you will be fruitful.
That's pretty much succinct and pretty much accurate the way I feel too. The Lord has a plan for you. So thank you, Greg Lang, for being a wonderful servant and a friend of mine. We want to. You're welcome. We want to share the audience how they can reach me. They can go to my digital business card, OVU/OnPassive, and they can reach me where they'll find two things. My influencer podcast, all the podcasts we've done, 50 or 60 of them are listed here, plus ways they can find more information about what I'm doing all the time. And I'm a retired dentist, so I'm not doing dentistry all the time anymore. So that's something you can find at drbillwilliams.tv. I did retire this year, Greg, finally, for the first time I can say it. And you can also find our AI business. We are into the software business now. And we have something that I wanted to bring out in terms of Greg and the nonprofit arena. We have a major platform for nonprofits to take advantage of for fundraising, for development, for innovation. And so one of the things that we are going to make available free for everyone in the world is Bless, a platform to showcase your ministry, showcase your nonprofit, and show how it can become self-sustainable. And so our goal is for all people who need services to have Bless to help bring them up to the level of sustainability without having to go into fundraising as a full-time job. And much like your program that you've got where people are in partnership, this is a partnership concept. So I'll just bring that out, and it's available for free. And we will be not charging anybody a percentage of the money that's raised. So that's another thing that's beyond the GoFundMe level, beyond the things that other people do. So Greg, thank you for being on our program today. I want to say, audience, stay tuned. We're going to have more sessions with the Influencer podcast later on today, but I don't know if anybody can top what we just did with my friend Greg Lang. Thank you for being here, sir.
My pleasure. You're very kind. Thanks for having me.
You bet. Okay. Take care, everyone. We'll see you soon.
Okay. Bye-bye. God bless.